I am passionate about fitness, health, wellness. I'm a yoga instructor and body worker, and surfing and foil boarding are my passions besides my family. I have a 5-year-old son. His name is Velzy, and he was 2 years old when I was diagnosed. And honestly, my biggest fear at the time was that I wouldn't live long enough for him to have memories of me. We tried to get in the water every single day, and I became kind of obsessed with big wave surfing several years ago when I realized how empowering it was to be out there in the ocean when there's monstrous conditions. That is something that I have still tried to stick with the best that I can through diagnosis. Hi, my name is Melanie. I'm from Hawaii. I have stage 4 ovarian cancer, and I was first diagnosed in the fall of 2022. I knew that I carried the genetic mutation BRCA1. It's a genetic mutation that a lot of women have that puts them at high risk for breast and ovarian cancer. I knew this because of my family history, and I had got tested because I knew my dad was positive for it. So I got tested in 2014, and I knew I was positive for it, so I had biannual screenings for both breast and ovarian cancer. In March of 2022, I had my biannual screening for ovarian cancer. Everything was fine. Um, However, my oncologist at the time had explained to me that the screenings that we were doing for ovarian cancer were like wearing your seatbelt in an airplane crash. He said, "Is it going to help? Maybe, but the likelihood of it actually catching something early enough is not very good." So, a couple months after that, I noticed a stabbing pain in, my lower right side. I thought maybe it was appendicitis, and, I just took a bunch of garlic. I'm a yogi. I'm kind of like an all-natural type of girl, so I was like, if I have a slight infection in my appendix, I'll just take a bunch of garlic," and it actually did go away. Um, then I developed a dry cough, and I wasn't sure. Shortly within weeks of developing the cough, I also got COVID. So when the cough didn't go away, I was just like, it's probably just lingering symptoms from COVID." We were in Nicaragua and Costa Rica, and around the last couple weeks of our trip, late August, my abdomen started swelling up. And every time I ate something that would normally give me a little bit of gas, like, say, beans, very common in Central America, it wouldn't be a little bit of gas, it would be excruciating. And I started eating less and less, and I noticed that my weight was dropping, but my abdomen remained distended most of the time. I thought maybe I had a parasite. I also thought maybe I was pregnant. My hormones seemed crazy. I was reacting to situations in ways that I would normally never react. And I was nauseous. So after I took a pregnancy test and found out I wasn't pregnant, because my cycle was weird too, I thought, okay, let's just go on a parasite detox. I'm in Central America. The likelihood that I picked up a parasite is pretty high. But I also had in the back of my mind the fact that I was genetically predisposed to ovarian cancer. So a few days before we were scheduled to return back to Hawaii, I did Google symptoms of ovarian cancer, and a list of 12 symptoms came up, and I had every single one of them. And so that's when I had to just take a deep breath and go, okay, the reality is that I am at high risk. I tried to stay really calm. I made an appointment right away to see my oncologist and get testing done. But in Hawaii, the medical system is slow, and there was a 2-week delay before I could get any testing done. So it was a long 2 weeks of using my yoga practice, of just trying to stay in the moment, trying to feel the sensation of fear in my body, trying not to let my thoughts spin out of control, because there was nothing I could do. There was no I had done everything. I had done my due diligence, right? Like, I made the appointment. And other than that, everything else was out of my control. So, I did go to have a pelvic ultrasound, and I remember the ultrasound tech seeming nervous, within minutes of putting the goo on my belly, and she was just like, I'm gonna go get the doctor." So she came back in with the doctor, and the doctor said that she would be sending me images to my oncologist, and that she thought it was related to my BRCA, mutation. And so that afternoon, I had a blood test, and my oncologist office called me and said they needed to see me in person the next morning. And so that's when I kind of was like, okay, here we go. The ovarian cancer blood marker test is called a CA-125. And that evening, after getting the ultrasound and the CA-125, I was able to open my chart portal and see the blood markers were like 10 times were of the normal range. Um, so I kind of knew right then, but then the next morning it was COVID, and 2022 was COVID was still pretty strong. So I couldn't bring my son with me to the doctor. So my husband stayed home with my son, and I called my friend to go with me. And we went to see my oncologist like 8 a.m. the next morning. And he was kind of like, he did an exam, a physical exam. And he was like, well, if this is what we think it is, and then you'll need chemo. And if this is what he kept saying, if this is what we think it is. And then my friend was just like, what do we think this is? And I was so grateful that she said that. And I'm grateful that my doctor was, he didn't, we didn't have a biopsy, we didn't have anything concrete at the time. But he had done the exam. He said he felt nodules when he did the exam. And, he's seen hundreds of these cases. So I was grateful for the way that he said it, but also grateful for the fact that my friend was like, just tell us. And he said, we think this is ovarian cancer. And I was like, okay, what stage? And he was like, well, it's in your lungs, like because of the cough, because of the symptoms, the pleural involvement. And he was like, it's most likely, 3C or 4. And in the moment, I was pretty calm. It hit heavy. Nobody's completely calm when they hear cancer. That's a heavy word. But I was like, okay, because of my background in surfing, I have trained myself to stay calm in very scary situations. And so there's a mantra I use in surfing that's like, you can panic when your feet hit the sand. Like, it's good to feel all of those emotions, but not right now. So I kind of just like deep breaths and like tried to remember everything he was telling me. And then my friend and I walked outside the hospital, and that's when we just both kind of melted down together. Uh, I I didn't tell anybody except for my parents at the time, because I was scheduled for surgery 2 days later, as well as a CT. So we wanted a surgery because in Hawaii, it was impossible to get me in for a biopsy, but it was much easier for him to schedule a laparotomy, which is where he was just going to stick a scope in and see what was going on, as well as take biopsies at the same time. It's just the way the medical system is here. Things can be a little bit slow, a little bit turned around. So I was so grateful that he did that. So it was 2 days later when we, got the official biopsy results. And then I could officially know what type of ovarian cancer. Um, uh, and what stage and what grade and all of that. When I saw that it was metastatic stage 4 cancer, that the 5-year survival rate was 17%, I felt like game on. It's I'm about to go through the hardest thing I've ever been through, and I just had this peace that it was gonna be for my highest good, even if I didn't survive it, that something was going to come out of this, whether for me or for my family, for my child, for my parents and my siblings, for the world in general, that could not have come if I didn't get cancer. And I don't want anyone hearing this to feel like they should feel that way, or to feel like it's some kind of spiritual bypassing, because there was terror, and even talking about it now, I'm very emotional. Like, you know, I I just had a knowing, um, and it was a peace that came from another place, that this was going to be for my highest good, and I was excited. I've always loved a challenge. That's just the type of person that I am. And so, yeah, looking at those results in black and white, I felt like it was another big wave to surf. My doctor right away gave me what would be like the standard of care. He ran through, like, you're going to need neoadjuvant chemotherapy, which would be, I did 4 rounds of chemo. From what I understood, for first line chemo, it was going to be the same medicine no matter where I went. And I felt comfortable. I really loved my doctor. So I went ahead and did my first chemo here, as well as the surgery, and I really was very, I requested many times from my doctor, "Is it possible to do my debulking surgery laparoscopically?" And he said he would do his best, because I didn't wanna be split open from breastbone to pubic bone, given that I am an athlete and that's an important part of my life. So he did a wonderful job. Recovery was much easier than I thought. For one, I didn't want menopause. And for two, I really, I love, this is gonna sound crazy, but I love cycling. I love the rhythm that it's put into my life, and the way that I've organized the flow of my month around my cycle. And I was afraid that I would lose some sort of femininity. I was also afraid of being cut open and the recovery time, since I was surfing. And, after a surgery like that, you can't lift more than 5 pounds for 12 weeks. I thought that I might never recover to even, 95%, or, that I might not even recover to 50%. I was really afraid. I went on a Facebook group for women with ovarian cancer, and one part of my body that I have always loved is my abdomen. And I asked if anyone was willing to share their photos of their surgery scars. And I was so blown away by what these women, most of them were elderly, most of them not in, what you would consider, Instagram model shape, posting these photos of these zipper scars up and down their abdomen. So proud of it. Like, so proud of what their body endured, and how their body showed up for them, and how their body helped them to move on. And once I saw that, I felt so much more comfortable with what was about to happen. I still begged my doctor, "Please do it laparoscopically," which he did. But I remember that day going into surgery and them wheeling me in, and, saying goodbye to my best friend. She held my hand right up till I went in that door. And I remember right as they're about to put me under, I just got really scared. Like, terrified. Um, and then, of course, I fell asleep within seconds, but I woke up back in that same terror. And when I woke up, um, I was after the recovery room, they brought me to my room and I was this is another thing about Hawaii. I woke up in my recovery room in my room and there was a cradle. I don't know what else you call it, like one of those a newborn cradle, a bassinet. And there were signs on the wall about breastfeeding positions, and I was in a labor and delivery room, and I had just been surgically sterilized. And this nurse came in, and this nurse's aide, and I was like, um, why is there bassinet here? She's like, "Oh, this is labor and delivery." And I said, "Why am I here?" She said, "Oh, this is where we put all the people with the lady bits." And I was like, "But I don't have any lady bits anymore." I was devastated, and I still am. And I think about, like, okay, there's other options for children but I'll never breastfeed again. I will never give birth. I will never grow a child inside of myself, and those are losses. Those are big losses. However, when the cancer came back 14 months later, I was hesitant to do my chemo again in Hawaii. Not necessarily because of the medical system, although I did want a second opinion because the more occurrences of cancer, the more the treatments begin to branch off and vary. First line is always the same, second line is very similar, but then third, fourth, this is where things get more complicated. Um, and the biggest thing was lack of support. I don't have any family here. And through all of this, my husband and I struggled to find a rhythm together and struggled financially. So I did decide for my second line chemo to go to the mainland and live with my family, where there's very good medical care in Michigan. They call it the medical mile. I do feel like at some point, as far as availability of clinical trials and availability of like doctors who are researching the cutting edge stuff, there definitely is more on the mainland. I'm on an oral chemo medication, it's called a PARP inhibitor, as well. It didn't seem like that was doing its job, so we added Avastin, which is a medication that it, stops blood vessels from forming. So, basically, it makes the cancer more susceptible. It makes my whole body, unfortunately, more susceptible to the oral chemo. So, I do get an infusion every 3 weeks as well as taking oral chemo every day. And right now, I'm stable. My cancer there is cancer in my body that is imaged on a CT, but, I just had a CT this weekend and, nothing has progressed in the last 3 months. So the treatment that I'm on is at least keeping me stable and honestly feel pretty good on it. I I'm not, maybe where I would be if I didn't have cancer and wasn't on any treatment, but I still surf on a daily basis. I work out on a daily basis. I teach yoga, I do massage therapy. I keep up with my son. It's a lot and most of the time I have the energy for it. Of course there's like the things like the migraines, the constipation, the neuropathy, all of these things that come along with chemo, but they've just sort of become part of my life. He just started kindergarten, and it is a breath of fresh air. But until that, um, honestly, I relied on caffeine a lot, um, because he would drag me out of bed way before I was ready to get out of bed, and I generally go to sleep with him, um, 8 o'clock, and by 6:30 in the morning, he's, "Rise and shine, mom." But I could use 12 hours of sleep a day, easily, and when I'm in chemo infusions, even more. We always napped together when he was still taking naps. I did pay a lot of babysitters. I did have to humble myself and ask a lot of friends and neighbors, like, "Can you just take him for an hour?" And that was really hard because a lot of times I was asking a neighbor for help while my husband was available to help, but not willing. So it was quite humbling to do that. So yeah, it was a lot of asking for help. Now, when he's in school, I have those 6 hours to do what I need to do to make my house feel like a nice place so I can relax, um, to meditate, to lay down and close my eyes for 20 minutes so that when he comes home at 2 o'clock, from 2 until 7:30, I am fully his. The biggest thing that's changed with parenting is how much I appreciate the gift of being able to parent. Laying in bed with him at night used to take him like an hour to fall asleep, and I would lay there like, "Fall asleep, fall asleep." No, this is my time. I need this time. Now, when that's happening, I can't say as I don't feel that, but I catch those thoughts and I'm like, "Melanie, this is amazing. Like, you are laying in bed with this little thing that loves you so much tucked into your chest. Like, can you just let your chest rise and fall with his? Can you just be here with that?" And it's so much easier now to just soak in those moments and appreciate sitting on the floor with my back hurting playing Legos. Like, I can actually really love and appreciate that in a way that I never could have if it hadn't been for the diagnosis.
Yes, there's no rule. Oh my gosh! Woo!
Cancer can be a blessing at the same time as being the most awful thing you might ever endure. It can also be a blessing at the same time. It has been for me. It's changed me, it's shaped me. It's showed me the goodness of humanity. I have stronger relationships. I love my body more than I ever have. I appreciate my son more than I ever have. My anxiety is all but gone. Um, I am a better person for having cancer. And treatment, honestly, has never been worse than being pregnant. um, it's for me, this is my experience. It doesn't have to be brutal. There are moments, of course, that it is. And there are moments that it's just not a big deal. And so I would want anybody who is newly diagnosed or worried about a diagnosis to just know that it doesn't have to be awful and that you can do it and that it has hidden blessings as well.